Transforming Care, a QI initiative to reduce restraint use through improved communication and staff training in behavioral health units. Bebongnchou Munkem, Maryville University, July 2026. The committee members for this QI project were as follows. My chair, Dr. Carol Berger. My second reader was Dr. Paulette Jones. And my community member was Lillian Laimo. Background and significance. The utilization of restraints in behavioral health units is a complex and multifaceted issue that poses significant challenges to healthcare providers and patients alike. Restraint use, while sometimes necessary to ensure patient safety, is often associated with adverse outcomes, including physical and psychological harm, and should be reserved as a last resort due to the elevated risk of harm to the older population. Specific injuries related to chemical restraints include seizures, falls, cerebrovascular accidents, and mortality, while physical restraints are associated with functional decline, such as incontinence and death. Past research has shown an increasing recognition of the need to investigate alternative methods for managing patient agitation and aggression in such environments. One promising avenue for reducing restraint use involves improving communication and staff training in evidence-based de-escalation techniques. Equipping healthcare providers with the skills and resources to manage challenging behaviors creates a safer, more therapeutic environment for patients admitted to behavioral health units. The aim of this QI study was to determine whether structured therapeutic communication and early escalation identification reduce restraint use in an adult behavioral health unit. Review of literature. This project aligns with a growing body of literature demonstrating that communication-focused interventions improve early identification of behavioral escalation and reduce reliance on restrictive practices. As indicated by Evans et al. 2019 and 2020 and Hong et al. 2019, the initiative was grounded in evidence showing that enhancing therapeutic communication, and improving early identification of behavioral escalation led to safer, more effective de-escalation practices. Systemic reviews provided robust support for restraint reduction strategies such as structured interventions, including communication training, which significantly decreased restraint use across hospital settings. Similarly, Price et al. 2023, Kim et al. 2020, and Hong et al. 2019 concluded that communication-based de-escalation strategies are among the most effective methods for preventing restrictive interventions, reinforcing the relevance of this project's approach. Evidence also highlights the importance of staff training and interdisciplinary teamwork. Boas et al. 2021 demonstrated that therapeutic communication reduces conflict and aggression in psychiatric units, directly supporting the intervention's focus on staff education. This project reflects the evidence, noting that educational sessions, reinforcement strategies, and workflow integrated into practice to strengthen communication and reduce restraint events were integrated into practice. Theoretical framework for this QI project. The Plan Do Study Act PDSA model was used for this QI project. The Plan Do Study Act model guided iterative refinement of communication strategies. It supported real-time workflow adjustments. The Plan Do Study Act also ensured fidelity of intervention and continuous monitoring. It provided structure for testing change and evaluating outcomes. Methods and design for this QI project. Design. It was a quantitative pre/post intervention QI project. The setting of this project took place in an adult inpatient behavioral health unit in Western United States Hospital. Intervention components. The components involved in this quality improvement project were therapeutic communication training, early escalation identification, evidence-based de-escalation strategies, reinforcement sessions, plus workflow reminders. The data source for this QI project was the retrospective EMR review, that's the electronic medical record review. The outcome variable for this QI project was restraint use, which was binary. Sample. Total episodes for this QI project. We had a total of 150 restraint-related episodes. Out of these 150 restraint-related episodes, 75 were pre-intervention and 75 were post-intervention. Excuse me. The age range was between 18 to 79 years. The participants were all eligible patients' records. The demographic collected were age, gender, ethnicity, and restraint status. Data analysis. The software used to collect the data for this QI project was Microsoft Excel and IBM SPSS version 29. Statistical test. The Z-test for two independent proportions was used to analyze the data for this QI project. Why this Z-test was used? The rationale was that it was appropriate for large independent samples. The Z-test compares proportions of restrained episodes pre versus post-intervention. It also determines statistical significance of change. Results of this QI project. Analysis of 150 restraint episodes, 75 pre-intervention, 75 post-intervention, showed a marked and statistically significant reduction in restraint use following implementation of the structured therapeutic communication training program. Before the intervention, 68% of episodes involved restraints, meaning approximately 51 out of 75 patients were restrained and 24 were not. After the intervention, restraint use decreased to 18.7%, or about 14 of the 75 patients, with 61 episodes managed without restraints. This represents an absolute reduction of 49.3% points and a relative reduction of more than 2/3 in restraint utilization, indicating a substantial improvement in clinical practice. A Z-test for two independent proportions confirmed that this change was significant because the p-value was less than 0.0001, making it unlikely that the reduction occurred by chance, and the effectiveness of the communication-based intervention over the 10-week time frame. Results pre versus post comparison. Pre versus post intervention comparison bar chart visually contrasts the number of restrained versus not restrained episodes before and after the intervention, highlighting the sharp decline in restraints and corresponding increase in non-restrained episodes. This bar chart highlights the effectiveness of a communication-focused intervention. Results pre-intervention pie chart. Pre-intervention distribution. Restraints were 68%, while not restrained were 32%. This pie chart demonstrates baseline over-reliance on restrictive interventions. Results post-intervention pie chart. Post-intervention distribution. Restrained 18.7%. Not restrained 81.3%. This pie chart shows reversal of baseline pattern. Majority of episodes managed without restraints. Limitations to this QI project. This project took place in a single unit setting which limits generalizability. The QI project was very short. The time frame was short. It was a 10-week time frame. Modest sample size. The sample size was 150 episodes. Patient population was limited to adult patients only. Staff turnover may influence training fidelity. 3 units were under quarantine for COVID, hence were unable to participate in this QI project. Discussion. Structured communication training significantly reduced restraint use. Staff demonstrated improved confidence and early escalation recognition. Intervention aligned with national priorities for restraint reduction. Research question answered. The research question for this QI project answered yes. Structured therapeutic communication reduces restraint episodes. Implications for practice. The implication of this QI project enhances patient safety and therapeutic rapport. This qualitative improvement project reduces staff injuries, emotional distress, and regulatory risk. The QI project supports trauma-informed, culturally responsive care. The QI project strengthens interdisciplinary teamwork. It provides a replicable model for other behavioral health units. Conclusions. The intervention produced a statistically and clinically significant reduction in restraint use. It demonstrated feasibility and sustainability of communication-based strategies. Future work. It expands to multiple units. The QI project can expand to multiple units, extend the time frame, and integrate simulation-based training. Impact of DNP program. This QI project strengthens leadership, QI, and evidence-based practice skills. It enhanced ability to design, implement, and evaluate system-level change. Finally, it deepened commitment to patient-centered psychiatric care. Thank you.